Okay, ladies and gentlemen, we're going to make a bit of a start. My name's Professor Chris Bain. I'm one of the professors here in the Faculty of IT. I also work right across the uni on this particular topic of digital health. So it's a great segue from our Dean John, who's spoken about fighting disease, for instance, and also about the concept of IT for social good. And I've put in big capital letters there, your, because whether you're going to study IT or data science or things like that with us, or whether you're not, eventually this will affect you. Healthcare affects everybody, even if it's the last day of their time on Earth. It affects everybody. So hopefully some interesting things to hear today. The other thing I'd say is this is an example of hopefully the sort of vibe you've got walking around the campus today. Monash is a very big place with lots of capability. And it's really important to have that capability on this topic. So if you go to a smaller uni with an interest in this topic, unless they have a big health school like we do, it's sort of a bit out of context. Something like this topic is really about working across disciplines. IT and healthcare is a bare minimum, but it can also include engineering and business and all sorts of other areas. So why are we talking about this thing? Why is digital health a thing? And why is this getting airtime all around the world? If you guys Google this topic, this term, you'll see references to it all around the world, especially America. America's miles ahead of us in this space, gives us a sense of where we might end up, where we might want to go. But many countries of the world are talking about this topic, and for a range of reasons. And I suppose a really important takeaway is getting a sense of what this might mean for you as future IT and data professionals. And as I said before, healthcare is unavoidable. It eventually catches up with us all, most of us well before we pass away, and can affect many of us through many years of our lives. So one of the reasons this is getting traction around the world is some macro trends in, putting very simply, in computing, in healthcare, and even in the social environments in which we sit. So things like the mobile phone, you just saw some of John's slides potentially about that. Certainly computing power, being able to publicly access the cloud and to rent space and capability, and data access. You know, we have these things and various other incarnations of collecting data that can be relevant for our health and wellness. There's a social appetite. So the idea of using AI or data science isn't nearly as scary as it might used to have been, although there's still a bit of a fear factor there. And certainly the human capability to do this work is probably as great as it's been at any stage in history, but there's enormous scope to continue to improve that through training people in this space. Healthcare has its own macro trends around the world. One of the reasons you'll hear this topic looking at major governmental reports from around the world is healthcare in most Western countries, we simply cannot keep doing it the way we've done it. And if you just follow something as simple as the headlines on the Herald Sun, you will see symptoms of that almost every week. Mum and dad have to sell their house to pay for the kids' cancer treatment. All these people queued up in ambulances to get into emergency, people waiting a year for their surgery, hospitals with not enough money to pay their staff, etc., etc., etc. So those of us who believe in this think that this is a way to, if you like, bend the curve of healthcare. As long as we can do it safely, to change it, make it more affordable and accessible for everyone going forwards. And there's also a lot of human variability in healthcare. If you consider something like a colonoscopy, the procedure we do to look for polyps in the colon or to look for cancers in the colon, some of you will undoubtedly have had one or know someone who has one. Even with best efforts, the ability of the person doing that to detect bad things is wildly variable. So on one hand, that's just simply not good enough, is it? Everyone should expect the same standard, the same ability to pick up a cancer in your colon or a precancer, irrespective of who does that procedure, right? And computing can help with that, digital health can help with that. Socially, we've got ageing societies. We have a Malaysia campus. I spend a lot of time with my colleagues in Malaysia. They have problems with ageing society just as we do. And that problem with ageing society affects the health workforce, especially the nursing workforce. So we've got more and more demand than we've ever had. We've got more expense than we've ever had, and we've got less and less people to do the work, right? So they're all major factors, as is a movement to citizens to have more control over their own personal data. That changes the game in a way that's really relevant in healthcare. So what is digital health and what are its hallmarks? Put simply, it's the use of digital tools and interventions in wellness and healthcare. So it's what happens out in the health industry, but clearly we do all sorts of things in the university setting, education to research in numerous ways to improve it, to advance it, to help it. It's got a range of incarnations from very primitive things to very advanced things, and I'll show you some of these advanced things in a minute, but its hallmarks really are apps and the mobile phone and sensors and what we call digital biomarkers, so measuring things about the body or about human behaviour through digital means. And also what I call, and more of us are using this term, augmented intelligence, which includes the other AI, but it also includes more simple things like data visualisation or virtual reality or augmented reality. The more of those things are in a particular piece of technology in healthcare, the more and more it's like a digital health intervention, if you like, or a product. Has anyone heard or seen of this before? Cardia. So this is a really good example of a digital health product, and it's in the American marketplace. Occasionally in an audience I speak to, even in Australia, people come up to me afterwards, I've got that. So what you're seeing there, and note the buy now and the free shipping in the US. What you're seeing there is one of the first and most established means to record a cardiograph on a mobile phone. And furthermore, and there's a bit of this detail on the right, it's actually in some conditions, in particular a condition called AF, I won't bore you with that because it's not a medical lecture, it's an important condition, it's better at picking it up automatically by artificial intelligence than we are as a health system. So that's got all sorts of interesting connotations for the future. Since then, that sort of two metal tab postage stamp things to touch, to generate the ECG can be done like this, through an Apple Watch. You touch the metal band, and that has the same effect as touching the two metal pads there. And it's gone even a step further, but for the interest of time, I won't hold you up there. So clearly that kind of thing needs a lot of IT to work. Right? You can see why that combination of IT knowledge in the health setting is really important to successfully deliver things like that. Who has asthma? Who knows people who have asthma or emphysema? Victoria, we often anecdotally say, is the asthma capital of the world. This is another digital health product. What it is the combination of that app on the screen and those little caps that go on top of your asthma puffers. And you might have two different puffers, in which case you could have two different caps and the system would acknowledge them. Basically what this means then, if you have asthma or emphysema, every time you use your puffer, no matter where you are, no matter when it is, it knows precisely how much of that drug you've had, versus the doctor having to rely on somebody remembering, which humans are notoriously bad at. The other thing it can do, it knows where you were when you did that. If you wish to do this, you don't have to do this. So it knows that you were in a street with a particularly high pollen count yesterday, or that the humidity or air pollution in your city currently is really bad. So the combination of all that information is leading to dramatic improvements in asthma control. You see down the bottom there. By some measures, 50 or 80% better, while sometimes using even less drug. So if that was a drug that said we can improve asthma by 80%, that would be on the front page of the newspaper and everybody would be asking for it. But it's not. It's a digital health intervention, okay? Again, lots of IT, AI, engineering, all important in delivering that. This is another example, and one of the examples which we're even starting to see here in Australia, artificial intelligence being used to analyse medical images. So the low-hanging fruit is images of the back of your eye, for instance in diabetes, images of skin tumours, images from radiology, and this is this particular case. So this is a product approved by the regulatory body in the US, where AI actually can detect fractures of the wrist 10 to 15% better than your average radiologist. Right. Very niche, but very interesting, again, a product But to deliver these products, you need a deep and abiding knowledge of IT, okay? This is a research example in Parkinson's disease. So a lot of the movement disorders, Parkinson's disease, Huntington's disease, even in dementia, having your phone or even another kind of wearable on a patient as they move around can give you a lot of information about the severity of their condition, okay? Versus just only being able to get it when you see the doctor, or versus just trusting from people's second-hand report, okay, which isn't very reliable, as I'm sure you can appreciate. This is a really interesting example. So the imaging thing in AI and digital health is a very well-trodden path. The industry is responding to it. Even in Melbourne, there are radiology centres that are bringing artificial intelligence in. This is really cutting-edge research, and it's one of the kinds of areas you could work in if you study data science and get to understand the space. And this is in the space of critically ill people in intensive care with a condition called sepsis, so overwhelming bacterial infection, which will kill you if you do not treat it. And it's dealing with a really specific part of the treatment paradox, which is raising the blood pressure of these patients with drugs, which can cause them to lose hands and feet. You would recognise from the press people who've been in intensive care and come out with their hands and feet amputated. And it's partly because of the drugs to keep them alive. Lose your hands and feet, keep your heart, lungs and brain, because you can't live without those, right? Literally down to that choice. Trading that off with how much fluid to give them. And this particular artificial intelligence research, it's not a product, research, was better at making that decision than doctors, based on many, many years of real-world data. So very interesting new space where these kinds of interventions might help us do healthcare better. Might mean that if you're sick in intensive care in Wangaratta Hospital, you can get the same standard of care that you do at the Alfred Hospital, right? Without having all the specialists having to live in Wangaratta, and that's a very real problem because they don't want to live in Wangaratta. Is that right or wrong is another question, but it's a fact. An example from here, so we have numerous groups in the Faculty of IT. We have a big data science group. We have a group looking at the social impacts of technology. We have a group that does software engineering, cybersecurity networks. We have a group called CHIC, Computer-Human Interaction and Creativity. Looks at things like human-computer interaction, as the name sounds, human-centred AI, visualisation, AR and VR. This is some work from a colleague of mine called Max Corday, which is basically, in long story short, reconstructing images of the skull, MRI or CT images, and putting them in a 3D space in front of you. And you can use those little sliders to slice through it and look at things. So off the top of my head, you know, could we educate patients about their brain tumour rather than just pointing at the screen, actually showing them the complexity of where that tumour sits deep in the brain, okay? Very detailed, strong IT skills to get to that kind of place. And you can learn those things here. So the take-home messages in this topic space, right? Current healthcare systems are not sustainable and they don't focus on prevention enough. And digital health has a specific focus on not just illness but prevention. And these systems will change and they must change. It's got an enormous future. So the latent potential in this career space in Australia is enormous because us and everyone who isn't the US have such a long way to go. A sound technical foundation through an IT, software engineering, computer science degree will serve you very well if you like the sound of working in that space. And we expect more and more hybrid education. So a lady called Marilyn Baird is just going to raise her hand up there. We've worked on a first ever, Australia first combination of a radiation sciences degree, people who become radiographers and radiation therapists, combined with IT. So when they get out in the health industry, they can really work deeply at that intersection. And if you're interested in digital health, Monash is the place to be. As I said before, places simply do not have the breadth of capability, the opportunities for students if you wish to develop a career in this space. So thank you very much.